Parents, let's talk about ear infections. This is a huge topic. This is one that affects so many kids, and it's honestly one of my favorite things to help with. I would probably say it's number one, the very top of the list, because it affects so many kids, because it wrecks their health in so many ways, right? That chronic antibiotic usage ruins our gut, ruins the rest of our immune system. And this is something we see such great results with pediatric chiropractic. So let's answer the three questions. Let me tell you about the three questions that you need to be thinking about or asking if you want to help your kid get more natural, more drug-free relief from this ongoing challenge. So let's walk through it. First question is really the most important one, and that is understanding the why, understanding the cause. That's the first question that we need to be asking with any childhood struggle or any challenge for anybody. If we understand why something is taking place, it really leads to all of the next steps. So with ear infections, what is often said is these eustachian tubes in kids, which is that tunnel connecting our ear and that inner tube to the back of our throat. Eustachian tubes in kids are more horizontal instead of more tilted downwards. And so fluid tends to get more stuck, more jammed up, which means that breeds infection and it breeds more challenges. And yes, anatomically that is true, but it's not really the reason why it's happening, right? Because these tubes aren't just a hollow pipe that you tip forward and then all the fluid runs out. Think of it more like a collapsed muscular tunnel. It's like a tube of toothpaste. That fluid doesn't move if you dump it. You have to squeeze that motion. You have to squeeze it along, which is this movement called peristalsis. It's the same way that food moves through your gut or your GI system. So it's not really the angle of this tube that's the key. It is how much tension is on that. Is it functioning as it's supposed to? And this upper neck area, this C1, C2 cranial occiput region is everything for that. It's the nerves controlling some of that function, and just structurally, anatomically, if this is really torqued and twisted and stuck, that motion and movement is going to be limited, and we're not going to get that fluid draining as we should. So that is our why. That is our cause, is that it's a lack of motion that is leading to those limitations in the drainage. Now, the other two questions that I want you to be thinking about are kind of connected, and that is how severe is this, and what can we do to actually help heal? And what I mean by this, how severe? A lot of times you're at a doctor's appointment, maybe you're there for a normal wellness check-in, maybe they're dealing with some sort of ache or pain or struggle, some immune challenge, and they look in their ears and they go, oh, there's an ear infection. That's the message you get from your healthcare provider. Let's hone in on that, because this isn't a black or white, it's there or it's not. This is a gradient, right? It is a perfectly normal, healthy eardrum, or it is a red, bursting, inflamed, pussing everywhere eardrum. And that severity can really guide your course of action, right? A less severe, like yes, it's there, but it's not about to rupture. That situation buys you a lot more wiggle room, right? You don't have to urgently intervene and treat it with medications. That's where we can look to things that are going to help it drain and heal more holistically and more naturally, because there's not really a risk at that point. And you can keep monitoring it every day, every couple of days to check in, but that how severe leads us to then what we can help with. And yes, there are other, I would say, more natural pain relief approaches that might look like garlic mullein oil drops in the ear. Silver can be, colloidal silver can be a really helpful antimicrobial, antibiotic option too. But really my favorite way to address that is actually addressing that why, that cause that we started with, which is why isn't this moving? That is where the pediatric chiropractic piece comes in, is these gentle, specific adjustments in the upper neck, restores that motion, helps our immune system and that neurology function like it should, and allows this to drain. That is why we see time and time again kids who've had recurring ear infections start care and never deal with them again. Or when they do come up, and when we do have some of those ENT drainages because life gets challenging, we're able to get after it with a few extra adjustments. They're able to heal, they're able to get back on track without needing antibiotics and without needing medications. So you're gonna have so many other side effects and so many other downsides, like wrecking our microbiome and creating other GI system issues down the road. So that's what I want you to think about. If you've got a kid struggling with these chronic ear infections, let's start to ask, why is it taking place? And then when we're in the moment, say, okay, how severe is this? How does that guide my course of care and what I need to do to handle this? And then what is a way you can get to that actual solution? If you want to find out if what we do is a big piece of that puzzle, please reach out, send us a message here, call the office. We can chat you through what that looks like and walk you through the whole day one, day two experience, and make sure that we can get your kid feeling better, make sure that they are reaching their full potential.